So I think what was most impactful at this year's ASCO from the standpoint of kidney cancer and bladder cancer, which is what I covered, was certainly the EV Pembro combination has now taken over as the preferred recommended therapy for metastatic unresectable bladder cancer over chemotherapy alone. And the quality of life data that was presented supports that not only does it improve overall survival, progression-free survival, but it improves quality of life compared to chemotherapy alone. But I think equally important, although certainly I'm a big fan of that being a preferred category 1, I thought that the data on the gemcitabine cisplatin nivolumab data, followed by nivolumab for 2 years, was really intriguing in the patients who had lymph node only metastases, because they had a much higher complete response rate, a much higher durable response rate, and a much higher overall survival compared to chemotherapy alone, which makes me think that there's a potential for taking some patients that I would have thought were not curable and potentially converting them to a curable state by consolidating with either surgery or maybe radiation as the alternative therapy after this chemotherapy, immune therapy treatment. So I think there was a lot of interest, and it's always nice to have more options for the treatment of advanced bladder cancer.